How does universal health care work for Americans in Europe? Imagine moving to a new country where health care is not just a privilege but a right. In Europe, many countries offer universal health care, making it accessible to residents. For Americans, understanding this system is key to enjoying a smooth transition. First, to access universal health care, Americans need to establish legal residency in a European country. This often means registering with local authorities and meeting specific visa requirements. Once you are a resident, you may qualify for public health coverage, but the process can vary from one country to another. Next, most European nations requiring residents to either contribute to a public health insurance scheme or purchase mandatory health insurance. For instance, in Germany, having health insurance is necessary to obtain a residency permit. In France, after 3 months of living there, you can access public health care through programs like Protection Universal Malady. In Spain, your access depends on contributions to the social security system. During your initial period, securing private health insurance is often a wise choice. Now let's talk about coverage and costs. While universal health care is not free, it is funded collectively through taxes or monthly insurance premiums. These costs are usually lower than private insurance in the United States. Services covered typically include doctor visits, hospital care, emergency treatment, and prescription medications. However, some countries may have co-pays or fees. For Americans traveling temporarily in Europe, the European health insurance card can be a handy tool. If you are insured in a European Union country, this card allows you to access necessary health care under the same conditions as locals. Keep in mind that this card does not replace travel insurance and does not cover private care or planned medical treatments. Since American health insurance usually does not cover medical care abroad, it is essential to secure appropriate health insurance when moving to Europe. This could be a mix of public and private insurance to ensure you have coverage from the moment you arrive. Private insurance may be necessary during waiting periods or for services not covered by public systems. European healthcare systems are known for their high standards and accessibility. Many healthcare providers speak English, which can make communication easier. The systems are designed to ensure equitable access, aiming to prevent financial strain due to medical costs. For a smooth experience, here are some practical tips. Research the healthcare system and insurance requirements of your new country before moving. Obtain private health insurance for initial coverage or if public insurance eligibility is delayed. Register with local health authorities promptly upon arrival. Keep documentation of your insurance and residency status handy for medical visits. Lastly, understand any co-payment or referral procedures to avoid unexpected costs. In summary, Americans can access universal health care in Europe by becoming legal residents and enrolling in the local public health insurance system or purchasing mandatory insurance. While American health insurance typically does not apply abroad, European universal health care offers comprehensive and affordable medical care integrated into the social system, providing peace of mind and financial protection for expats.